right, super excited to be here with you guys. I have a awesome guest this week, and we're going to dive in more into hormonal and fertility. So, if you guys don't know who I am, my name is Stephanie Duran de Rodriguez, and I am a mother of six children from 18 to 4 years old. And regardless of my dyslexia, I've been really diving into everything about women's health. From being a doula, student midwife, emotional healer, and health coach. Now, this week's topic, we're going to dive into inflammation regarding and linking to infertility. And I just love this topic because I could, just the research I've been doing in my school as as a midwife student, I could see how it just links and links to so many things, especially like the conflicts and the complications in pregnancy. And so I'm going to introduce our guest, Nancy DeMaria, who's a uh, fertility expert. So thank you for being here. So I would love you to share a little bit about your background. How did you dive into this, topic of fertility?
Yeah, thanks for having me, Steph. I really appreciate it. And I'm so excited for you on your journey to midwifery and all the wonderful things that you're doing with women and couples already. You are just, I mean, you are just on track to, as you become a midwife, just to make such a huge difference in so many people's lives, so many families' lives. So that's really great. Um, to so so my story started like a little over 10 years ago. I was um, always interested in women's health, helping mothers, babies, families. That was always my goal. um, I went to grad school for maternal and child health at UNC Chapel Hill, got my master's degree there, and helped start a fertility clinic here in North Carolina that was focused on, or is focused on, fertility awareness based methods of family planning and treating infertility without the use of assisted reproductive technology. So, um, my own personal journey, going back now over 10 years ago, basically, I would have been the prime candidate for an unexplained infertility diagnosis. So I was learning, um, I was doing research in charting and a very specific type of charting, cervical fluid. And I was talking with one of my mentors one day, and he said, if you're wanting to really get into this research, you need to chart yourself. And I was like, well, I'm not really trying to avoid or achieve pregnancy right now. Like, I've always had pretty much 28-day cycles. I've never had pain. I've never had any issues. And I'm obviously, why wouldn't what I'm thinking is, I'm obviously really fertile. Why would I need to learn how to do that? I didn't tell him all that, but he was just kind of like, you should do it. And I really respect his opinion a lot. So I was like, oh, okay, I know about the physiology of fertility. I'm obviously going to be okay, but sure. Okay. I'll learn how to chart. So started learning how to chart. Meanwhile, beginning in uh, I don't know, but maybe sometime when I was around 20 or so, I started losing hair on top of my head, getting a lot of excess unwanted hair growth, really bad cystic acne. I'm half Italian, so I'm kind of prone to be a little bit more hairy anyway. So the hair growth was like, okay, this is whatever, this is annoying, but this is my genetics, whatever. What really bothered me was the painful cystic acne that nothing would make it better. Went to dermatologist. My OBGYN never mentioned anything about how hormones could be related or anything like that. And it was like, it just didn't matter how much makeup I put on. I knew that I just felt like I never really looked that great because it was just constant, and they would take forever to heal, and then they would scar. And it's funny thinking back on it now, because it's been, my skin has been so clear for so long now. It's hard to even remember what that was like, but it was a major issue for me. And topical creams didn't work. They're trying this, nothing that any doctor suggested ever did anything about it. And no one ever talked to me about root causes. So for me, that was my main symptom that really bothered me. Now, meanwhile, I'm starting to learn how to chart. I'm thinking I'm really fertile. It doesn't take but one cycle of charting, looking at cervical fluid, to see that I had a very limited fertile window. If I had been trying to get pregnant, I maybe had hours of a time where there would be enough cervical fluid to really facilitate conception. And my hormones were not balanced, and everything that was happening within the cycle, sure, they were 28 days long, but length of cycle tells you nothing about how fertile you are. And fertility is a sign of health. So if you are ever having trouble becoming pregnant, it's because there is something going on that's not optimal with your health. Maybe there's can be physical issues with your uterus. There can be genetic issues with the man and the woman and things like that. But overwhelmingly, there's an underlying health issue that needs to be addressed. So I started to kind of put the pieces together and think, okay, so I have a really limited fertile window. Okay, this is interesting. Still, no one was really telling me what to do about that, but it was just, okay, you have a limited fertile window. Okay, that's interesting. And then it was like, I don't know, maybe a year later or something. Again, I'm just trying to piece together how to fix my cystic acne. And a colleague who's a physician who had a lot of experience with infertility patients in Ireland, he said, almost in passing, he was like, you know what? I get a lot of success when my patients stop no gluten, sugar, dairy. So no sugar, no dairy, no wheat. And I was like, really? That really makes a big difference? Now that's a little bit more commonly accepted. Still, we're not nearly where we need to be with that in terms of general knowledge. And there's so much education that's needed. But this is now over 10 years ago. It was even less. There was even less education and knowledge and research around it. So I was like, really? Does that really makes a difference? And he said, yeah, it really does. And so things just started to click together for me where I thought, okay, maybe if I would stop gluten, dairy, wheat, maybe my fertile window would improve, and maybe that could also be related to my cystic acne. And so I was like, that maybe this is the missing link to get rid of my acne. Bam, one cycle. My cycle became, I had a beautiful fertile window. Acne disappeared and literally has never come back. So I had to fix that, that leaky gut inflammation immune response that was happening. And then from there, so we started the clinic, we built the clinic. Meanwhile, I'm doing more research, getting to know more patient stories and more doctor stories. And again, just piecing together the info, piecing it together, and realize that I got into, I was interested in charting and I was interested in fertility awareness, and that is really interesting, but it's actually not nearly as interesting as the infertility side of things and what you can do to really improve a woman's fertility in a really systematic, really efficient, an easier way, much easier way than the typical path that women are sent down right now. Because right now, the general path is 6 to 12 months of intercourse, unprotected intercourse. Okay, we'll do some labs. Here's your referral to a reproductive endocrinologist. Then meds, maybe some Clomid meds, that doesn't work. A few IUIs, that doesn't work. IVF. There's some minimal investigation of underlying causes there. Minimal. These women generally really do not have a clear idea of what's going on with their fertile window. It's a sort of top-down approach where fertility is just masking symptoms, and sometimes that works and sometimes that doesn't. So I saw this really clear window where there's like a hole in the market, basically. And that's how I got into my own business and what I do now. Because as wonderful as the work that we did in the clinic is, the level of hand holding and time with couples and time and really taking that time, the way our medical system is set up, that it's a clinic visit, it's just not conducive to a clinic visit. So I saw this opportunity to help women and couples get off of this mill, kind of this path that they were on that leads straight to IVF.
Hmm.
So
Yeah,
that was a
absolutely.
long answer. Sorry.
No, no, but it's good to understand that background. So they will say like, they always they ask me as well. So things I do to help families, like, well, how do you know? Are you just like someone who just read a book, you know? Um, but no, it's really important to know your background so we can see, where you're coming from. Like every time you're gonna interact with someone, it's good to know where they're coming from. And like you were saying, it's not only nutrition, it's also combining the gaps, like where are the gaps in the medical system. Like the medical system is really good, there's things that can help, and it's good to have them to like do further testings if you need. um, but like sometimes it's like, oh, you just need to be on the pill. Like a lot of times, like, oh, you have acne pill, you have a heavy bleeding pill, you don't want periods pill. You don't want to get period pill. Everything's like pill, pill, pill. And they don't really talk about the side effects that can happen. There's never, even if you go holistic or um, functional or just traditional Western medicine, it's always good to know that there's pros and cons in both decisions and how to combine those together to make it more optimal. And so yeah, like you were already talking a little bit about how you're healing your gut and helping with the inflammation. And so what has been your, I know you talk about a little bit like eliminating the things that are like, doing the flaring of immune response. So how can you really link? Like how can someone say, "Oh yeah, maybe I have like overload of inflammation?" Or how can you know like what kind of testing do I have to go further to determine what to eliminate in my diet to reduce inflammation?
I see. So you're wondering, a couple is experiencing infertility and they're wondering if inflammation can be is part of it. So that's something that we do in our programs. So this is not one of the fertility coaches on my team. She's a functional nutritional therapy practitioner. So she orders the labs, and then analyzes those labs and goes through step by step all the food sensitivities, what's going on with dysfunction, gut dysfunction, what's causing inflammation. Um, and those are tests that your reproductive endocrinologist is not, that's they're not going to run those. So, and even with hormone panels, a lot of times with thyroid, for example, they're looking at TSH. There's other hormones that you want to be looking at. So, what we do is a really thorough lab work approach that I know of no fertility specialist is doing, because that's, you just have to think about, it's a different mindset. It's, they're looking at how to override what's going on in the body. We're looking at how to get directly to the root of the problem. So I'm really big on uh, informed consent. So I totally realize that, like you were saying, like, there's drawbacks to something like the pill, for example. And I realize that, getting to the root of what's going on, sometimes it's not overnight. You know, if you do IVF and it works on your first try, then that's more of the overnight success, that people are looking for. My thing is, I just want people to be informed of all the options, and then they can choose what they want to do. If they still want to go on and do IVF or another round of, it doesn't matter to me, that's go for it. That's if that's what you want to do. But for me, it's all about being informed about your options and how something like inflammation could work. So rather than getting into specific tests, because it really is individual for each couple, like each couple that we work with, um, we're looking at the biomarkers of her cycle, we're looking at her symptoms, we're looking at other factors of what's going on. So that's going to be very individual to the couple.
Mhm. Yeah, yeah, it's really important to make it customized versus, like I think what backfires in the medical system is that everyone goes through this pipeline. Even in
Yes.
going to birth, it's like, oh, we're just gonna do this protocol, and not really having the informed, or they try to be informed, but it's not really the full informed. It's just like mostly the benefits of doing something um that they want. So it's just never like the fully exclusive informed information.
And there's
And
not a lot of time in a doc. I mean, there's not a lot of time that gets reimbursed by insurance. Um, yeah, I mean, I don't want to go off in too much of a tangent, but I like how insurance works and what gets reimbursed and what doesn't, which is no fault of the physicians. That's no fault of healthcare providers. That's how insurance is set up. I think that's what limits um, what can be done as well, unfortunately.
hmm yeah, I mean, we could just go into that topic. It's like a whole other topic.
I know.
We could
Let's not go
really
into that whole
dive into
topic.
that
Let's
for sure.
focus.
But what is like maybe like the first step to someone who's curious, like where am I and how, versus like saying, oh, you gotta like track your menstrual, because that's like a whole other level of like education. Because I have a friend who does it, and I haven't dive into that yet, but eventually I would love to like learn and get certified in that. But
Oh, you would
like
love it.
yeah, I will love it because everything I'm doing is just connects so well. But and maybe someone's like, oh my gosh, all these labs, like what is just one something simple that they could just take the first step that seems breathable for them to start understanding where they
Yes.
stand.
Yes, that is a great question. And here's what you can do on your own, and here's what you can do at home. And this is the first thing that I want to know, is do you have 4 to 5 days before ovulation of fertile cervical fluid that's clear or stretchy or has a lubricative feeling? Do you have that really healthy fertile window? That's the first thing that I want to know. Notice that I'm not saying what are your temperatures. Notice I'm not saying what do your OPK test strips say. Notice I'm not saying any of that. Notice I'm not saying download this app. Notice I'm not saying buy an Ava bracelet or buy what, nothing against Ava, but buy this bracelet or buy this device or buy this whatever. No, 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 no. By the time you see an LH surge, by the time you see a temperature shift, the egg may have already died. So after once the egg is released from the follicle, it lives for 12 to 24 hours. You don't know, no one, you don't know for that particular cycle how long your egg is going to live. It's 12 to 24 hours. If you're relying on seeing the LH surge or the temperature shift, you could have totally missed your fertile window. So the first thing I want you to do is I want you to be looking at your cervical fluid every day and make sure that you have 4 to 5 days of really healthy, fertile cervical fluid before ovulation. And I want you to do that for two reasons. Number one, timing, like I just said. The issue of timing is something that can be so easily missed if you're relying on temperatures and OPKs for the reasons that I just said. You could be missing the egg. Sure, you confirm that ovulation happened. Is that going to help you get pregnant? No. The egg's dead. What are we trying to do here? We're trying to get pregnant. We don't care about sort of just interesting information. We're trying to get pregnant in the healthiest way, in the quickest way possible. So
Mhm.
that's number one. You want to prioritize intercourse at the beginning of that fertile window and throughout that fertile window. Why? Because sperm can survive for days in that fertile type cervical fluid. So you want the sperm to be there the moment the egg is released, and that is just a pure timing issue. You don't need an app to do that. You don't need any kind of device. You need to be observing your cervical fluid on your own. And I'm not, and also you don't need to be checking your cervix either. I think sometimes people think about cervical fluid and that they have to actually be touching their cervix or something like that. No, you're wiping, you're observing your cervical fluid every day, and you want to see those several days of really healthy not vertical, fertile cervical fluid. For, as I said, number one, the timing for timing intercourse at a very, very, very basic level. You don't want the reason why you're infertile is because you've just been timing it wrong at a very
Mhm.
basic level. Number two, the second reason I want you to do that is because when it comes to fertility, a lot of times, kind of the only sign that we have sometimes is whether you get a positive pregnancy test. And that can be very frustrating and that can lead to burnout because you really have no idea if you're trying to make healthy changes in your life, if you know i- if you heard somewhere that maybe keto helps with fertility, and so you're like, okay, I'll try that, and then someone else says this supplement, and everyone has opinions and everyone has advice, and there's a ton of information online, and some of it is just wrong, and so this is what leads to burnout because you have no idea if anything is helping other than every month anxiously awaiting a pregnancy test. So here's what tracking your cycle just on your own without apps, devices, OPKs, blah, blah, whatever, what it does is it provides another marker for you, another way for you to see if anything that you're doing is actually working. So remember back to my example where, I would have been a prime candidate for unexplained infertility. I was able to reverse my PCOS. I was able to reverse these symptoms. Now I have the perfect fertile window. Um, so remember that example as you're making these changes. My window went from very, very little to healthy. So you should start seeing your fertile window become more healthy. So it's a way for you, without anyone else's help, without any tests, without anything else, just to have a marker. And it's that goes into your mindset as well, because then you have something that's like, okay, I'm not pregnant yet. I have another negative test, but I can tell that I'm on the right track. So that's absolutely what couples can start today. Absolutely start it today. Now, where we take it a step further in our program is we're teaching you a certain way we want you to chart. One of the fertility coaches on my team, she works with our clients one-on-one to make sure they're charting correctly, to help them just give accountability. And she, with her training, she can see from someone's chart where there's signs of possible silent endometriosis for couples who have no idea that that might be going on. She can see evidence of PCOS, she can see evidence of thyroid issues. So to a trained instructor, which is, I think you would benefit from this a lot and really love digging into this. It's almost, cervical fluid is almost like another vital sign. Like if your pulse is really high, and it's not, you weren't just exercising, or so, what's going on, I wonder what's happening in the body. If your respirations are suddenly really slow, if your blood pressure drops, I wonder, something is going on in the body. And it's the same with cervical fluid. Why? Because cervical fluid is controlled by your hormones. If you don't see that, there is something going on with you hormonally, period. I don't care what your, quote unquote, normal labs say, because that's how couples end up with unexplained infertility. The labs are normal, the tubes are open, the sperm is fine. you have unexplained infertility. You look closer at their chart and you see their cervical fluid, and then you do more in-depth testing and you see, no, of course, yeah, we did more testing. Of course, your hormones aren't normal. How could they be? If they were, you would be seeing this pattern. So does that make sense?
Absolutely. And I think that's just fascinating how, your body's so smart. It's like trained to do this. It's built to do so many things, and we don't give credit to it all the time.
Yeah.
We just ignore it. So we have to go and say, "Hey doctor, tell me," versus like, "Okay, let me give you the tools so you to understand," or have someone like, your coach that you work with that could see those little markers and be like, "Okay, let's bring awareness here, and this is where we want to like, see what's going on there." Yeah, and it's
Yeah,
really
and it's not the couples, it's not, no one is told this. It's just not, how fertility is approached in this country, at least. Um, and it's not their fault that they don't like that they don't know this. Like it's just what I always say is like my mission is to rid the world of unexplained infertility. I someday the standard of care that we provide with our clients, um, and it's all virtual. So when we order labs to have labs get done, we order them, to your local lab core, and they send the results to us. But that standard of care and that looking for the root, that should be the standard everywhere. And I will say we are a lot further ahead than we were 10 years ago. There's still um, huge opportunities to improve, though, and that's what I hope to continue to contribute to.
absolutely. And it's also like what happens once they get pregnant. This is where even working with people who know like childbearing class, who's a doula or a student midwife, like or a midwife, because then that's like another game that you're playing, like another roadmap. And like you said, like the standard of how to take care of someone, or we're never even taught in teenagers, like, hey, you should learn how to see what your body's telling you. Like,
Yeah.
let's communicate with your own body. I think it would have prevent so many things, or you would have been more on top of it. So like that's not even the standard. And then the standard of giving birth is like another thing, and we could just go on in there how even teaming up, like I think is so important, like also connecting that gap to someone who's like once they got pregnant. I don't know, I'm just thinking always like about connections, because
Yes.
then once they have birth and then there's postpartum, so it's like
And you know what? Those issues don't disappear when you become pregnant. They don't disappear when you're postpartum. They don't disappear when you're approaching menopause. So that's another, and I kind of um like, I don't know if a pet peeve is a right word or what, but if you're not um you know fixing those issues, the reproductive issues just tend to get worse with age. And that's just, and I don't, that's just a fact. That's just how it is. So what I look, when I hired the two fertility coaches on my team, when I hired, I mean, it was like, I'm so picky about who I work with, and finding them was like finding two unicorns. And they just 100% get it, that it's what we're doing is more than just about, we want to get you pregnant. I mean, that's definitely what we're doing. That's our main goal, but we're looking at over your whole reproductive life cycle and what this means down the road. you know it's one thing to get pregnant, it's another thing to stay pregnant, to make it past the first the trimester, to have to not have a preterm birth, to feel better postpartum. All of that is related to inflammation. All of that is related to hormones and immune response. So we take that very seriously. And um, I really feel like we're the detectives on behalf of the couple, really putting in the work to get to the root of it, um, so that they can, yeah, so that, basically acting as detectives on behalf to really find out what is going on.
Yeah, and I do agree what you're saying, like how inflammation to make sure the placenta is growing properly and certain hormones are allowing it to around the 12, 16 weeks that it's going to, form and, and communicate with the mother or the birthing parent and so forth, right? But not only that, I also been diving into like how inflammation is linked to emotional stress and understanding where each individual is coming back because everyone has different race and the outcome of how the system interacts with that individual. It just mind blowing. Like to even to go to that extent and understanding the public health and the disparities because we could be doing everything right, like here do cervical, like do this testing, do this blah blah, I'm gonna help you. But if there's still like something that are going in a life that you're not living, can influence, and that connection of inflammation are still spiking that inflammation when it comes to emotional stress. Um, I don't know. I think it's fascinating every time I go and diving into that area that could connect to inflammation and mental health. And it's just like, I don't know. I always think it's just not one thing, Like you have to definitely understand where these people are coming from to truly help them. Because, like, you are doing comprehensive, but then, like, adding that extra area is just going to be, like, I don't know, mind blowing. And that is something I'm, like, working to provide to individuals as I'm studying as a student midwife. It's just, like, a huge opener. Like, going to become a student midwife is just, it's not only just that. It's just, like, there's other stuff that was just, like, holy
Right.
moly.
Right. And nothing about it is static. So that's something that I've really had to do a lot of education around with our couples is, and again, it's not their fault because nobody has been taught this. But for example, when you get um, when you get some lab results back from your fertility specialist and your FSH is high, your follicle stimulating hormone is high, and you may even be on the verge of menopause according to that level. And they may even diagnose you with diminished ovarian reserve. Now, can they go in and actually count the eggs that you have left? No, but what they're doing is they're looking at, okay, this hormone levels at this hormone levels this. Okay, you looks like you have diminished ovarian reserve. It's going to be really hard for you to get pregnant. The human body is so dynamic and so responsive. And like I said, it's not static. And all the things you were just mentioning, none of that is static. Different sources of inflammation, however varied they may be, and your body's response to it is not static. So, so many times couples are surprised when I say, "Oh, your FSH is high." Well, we can lower it. It's not a death sentence. Now, once you're actually through menopause and you're post-menopause and, are you going to be able to get pregnant and can we lower the FSH? No, 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 no. But I'm saying, you can go from like Caitlin, one of our fertility coaches, one of her clients had a FSH in the 40s, and this woman was 30 something, and working with Caitlin lowered it down to a healthy range. It's like that's something that I really wish more women understood, was just because your AMH is whatever and your FSH is whatever and your progesterone is whatever, all of that can change. You can change that when you're doing things in a really targeted, systematic way, and in a way that doesn't, like how I've designed our program is with preventing burnout in mind, so that you can do these things. You don't have to do them all perfectly. And we're looking at the things that make the highest impact first and doing the test to show exactly what's causing your inflammation, what the food sensitivities at whatever. And doing it in a way that you can really incorporate it into your life without it taking over your life. So that you can really take advantage of your body wants to heal. Your body wants to have a baby. Your body wants to be fertile. So you're taking advantage of that and just really allowing your body to do what it wants to do, what it's designed to do.
Right. And so when you were talking about, that program that you're doing, that I'm not sure if it's the same price. I remember it was like 197. Is that where you ask everyone you should go into this intro? I don't know if it's an intro. Share more about it, to as a first step to get that, precise protocol that you guys do.
Yeah. Well, so if couples are interested in working with me and wanting to know more, they should just get in touch with me. I'm on Facebook. That's, the best place. Um, you can email me at superfertilesystem@gmail.com. Um, and what I would need to know is I would need to talk to the couple and just really see where they are. And then that would see where they are, see what they've tried, see what, um, yeah, just kind of where their history and where they are with things, and then I would be able to guide them to their best next steps.
Mhm. Okay. Um yeah, I think that's great. And so that's where they'll find you. Your Facebook or
Superfertile.com,
www.superfertile.com.
Nancy DeMaria on Facebook. You can DM me there, send me a message there, superfertilesystem@gmail.com. And yeah, happy to talk with anyone and just yeah, give them encouragement, see where they are, and s- get a good idea of what the next step should be.
Right, and that's perfect. Okay, awesome. And I wonder, do you guys say someone who's like menopause, like I'm in menopause, I'm miserable, blah blah blah? Do you have them track their cycle, or that's like a different way of tracking, or that's just absolutely no?
You're asking, is there any benefit for a woman going through menopause to track her cycle?
Mhm. Yes.
Oh yeah, sure. That could be helpful. Yeah, as long as you are cycling, that is helpful information to someone who's trained in understanding that information for sure.
Okay. Okay, perfect. Okay, awesome. Well, I think this is pretty much like the little questions I had for you. I think it was super helpful to at least, start sharing around, and people could understand at least like there's options, like, what else can I do if they feel stuck, or maybe they're barely diving into it, or maybe those are proactive, couples who already know there's more options and they're just trying to learn. But thank you very much for coming in and sharing your knowledge, and I'll be sharing all your description in the YouTube description there, with all your information.
Great. Thanks, Steph. I really appreciate it. Um, and best wishes to you on your journey and, all the ways that you're helping women and couples now and your journey to being a midwife. I mean, you're on a great track. And so I wish you all the best.